My name is Jodeme Goldhar. I am a member of the Change Foundation team in Ontario, and I am so privileged to facilitate our conversation today. I'd love to tell you a little bit about the Change Foundation and why we're having this conversation to bring all of us together in Ontario today. The Change Foundation, we are an organization that wants to and does enable collective impact, bringing multiple parts of our health system together to come around a common goal. Many years ago, we started on this journey under Cathy Fooks' leadership to work with organizations across the health system, hospitals, primary care, community care, health and social care, policymakers, researchers, policymakers, funders, to say how can we work together in a way that coordinates care, that integrates care. And we did that by listening to each other, learning from each other, and coming together around shared purpose and shared vision. That led us to a place where we started listening to and learning from patients and clients around what's most important to them. And when we do start to work together in a way that is collective, how can we design what is most important based on what people have to say is most important? And through that journey, we learned there was an invisible voice, that it wasn't just health service providers, policymakers, researchers, and funders, but also the experience of caregivers. People and their families and their friends who were providing care to the people, their loved ones, their family members, and we started to focus on listening and learning to what is most important to caregivers. And we come to a place today as an organization, and we've learned that by listening and learning and bringing us together around a common goal, we can enable all of us to realize our potential. And as we've been on that journey, we've also, instead of just looking within Ontario, we've been also looking far and wide. We've been connecting with people all over the world who's been part of the movement for change, movement for meaningful connection and change. And there is no greater guru on change and change agency and how to give us each the power to create the change we want to see in the world than Helen Bevan. And Cathy and I and the rest of our team have been collaborating with Helen for some time now to say what would be most useful and how can we leverage the experience of Helen to bring to bear on what we are interested in Ontario in terms of catalyzing meaningful change that matters to all of us. And Cathy Fooks, a preeminent leader in Ontario's health system who works from a place of values about saying what is most important, how do we listen and learn, and how do we work together around improvement and what is most important to catalyze change in Ontario's health system. And I have the rare opportunity to facilitate our discussion with Helen and Cathy. Before I do that though, we have a few hundred people online, just over 200 from all across Ontario and different parts of Canada and some folks from across the world. Our goal today is to have us engaged. So if you haven't already logged on to the chat, please do impress all panelists and attendees. As we are having a conversation with Helen and Cathy, I will be monitoring your responses and questions, and we want this conversation to really evolve the way it's meant to, in a way that's meaningful for you. So please use that chat function so you can start asking questions as well, and so that we can have what you need come out of our discussion today. We're going to start first with a poll, and we want to get you active and see what your thinking is. As we bring up that poll, please know we have two hashtags for today. The first is leading change. And as we all know, today is Change Day. As we all may know, today is Change Day, and it is no coincidence that we are having this discussion on Change Day. And you may or may not know that Helen Bevan is the founder of Change Day, her and two colleagues, and we'll hear a little more about how that started. But please hashtag Change Day, and please follow us on Twitter at Change Foundation, at the Change Foundation. So our first question, and many of you have already started to poll, is how ready is on the Ontario healthcare system for change? What do you think our appetite is for change? 10 is we are very ready, and 1 is not at all. So please don't be shy. We have 225 people who have joined us so far. Tell us what you think in terms of how ready we are for change. Our hope and dream is this conversation helps mobilize us. We might need to do this poll at the end of the conversation. And you can see where we're going. Some of us are very optimistic that in Ontario, we are ready for health system change. Many of us are moving towards that very high optimism. And a lot of us on the call, and there's 225 of us, are.
Can see it, yeah.
Oh, they couldn't see it?
No, they can see it.
Thank you. You know, Helen's an expert in polling online, and I'm getting coaching as we go. This is learning in action. And you can see that many of us are in a place of neutrality, probably hopeful for change to come, but neutral around if Ontario is ready for it. And some of us feel differently. Some of us feel that Ontario isn't yet ready for the kind of change that we want to see in the health system. So now let's go to our next poll, and thank you for doing that. Great job, everybody online, 225 people. Our next question that we want to hear from you is, to what extent do you feel optimistic about leading change within the health system, within your own teams, within your own organizations, within your partnerships? Please join us, 226 people online. Tell us your thoughts. Optimistic, cautiously optimistic, somewhat pessimistic. We want this to be a safe place so we can have a conversation that matters to you. To what extent do you feel optimistic about leading change within our healthcare system, within your own organizations, your teams, within your partnerships? I'm going to count down from 5 and then we'll end the poll. 5, 4, 3, 2, 1. Here are the results. Online, tell me, any surprises? Could you please use the chat function and tell us your thoughts and reactions to the poll? 16% of you feel very optimistic and 64% cautiously optimistic, which means we are at a great place to mobilize. Some neutral and some 19% somewhat pessimistic. Are you sharing online your thoughts and reactions to the poll? Surprised how many are somewhat pessimistic? Great. What are other people's thoughts and reactions? The people who are on the call are the ones who are engaged and hopefully will make the difference. Here to that. Who else? Not surprised, but cautiously optimistic. There's so much mobilization happening, hoping we don't have a failure to launch. And leading change isn't new to any of us. Well, that's a perfect place to start. Thank you so much for being engaged, especially grateful for how active you are on the chat. As I turn to Helen and Cathy to begin this discussion, I'll be monitoring your chats. Please do not be shy. I will do my best to bring in your questions to help start this conversation. Want to start where today starts, Change Day, and turn to Helen Bevan, the Chief Transformation Officer for the National Health System, who leads the New Horizons team in the United Kingdom and who is the founder of Change Day. Helen, start with Change Day and your story. And welcome, a warm, warm welcome to Ontario and beyond.
Thank you, Jodeme, and it's great to be here. And you know, in terms of just how many people have responded to be part of this session today, I think is really fantastic. And yeah, happy Change Day. So you know, for us in England, NHS Change Day, it started 5 years ago. And you know, it's interesting because I've been working in health and care improvement for a very long time. And you know, 10 or 15 years ago, it was so difficult to engage young and emerging leaders in change. So you know, we tried to get residents involved or trainees. You know, very often didn't want to get involved in improvement projects because they were so busy doing what they needed to do to get qualified. And then I think just 5, 6, 7 years ago, things started to change, and we started to see this whole group of trainees and students and young leaders who were really different, who felt very dissatisfied with how things were and wanted to change the status quo. And I was getting to know, in terms of being a leader of improvement in the NHS in England, started to get to know quite a lot of these young leaders. And I had a conversation with a trainee GP and a trainee paediatrician, and they said, we want to transform the NHS. So the three of us had a conversation, and we ended up saying, well, let's do this day. Let's create a day that we called NHS Change Day. And the thing about NHS Change Day was it wasn't official in any way. We didn't have any resources, we didn't have any structure. We just decided to kind of do it below the radar, and it just caught fire. And in that first year, we had 169,000 pledges. We had a pledge from the Chief Executive of the NHS, we had a pledge from ministers, from the Secretary of State, and it just went from there. And what I learned about Change Day is, there's this incredible kind of latent energy for for change and for positive moves forward. But I think that very often we fail to tap into that. And I think for us with NHS Change Day, we tapped into a very kind of rich vein of people that wanted to make a difference. And Change Day gave a lot of people a platform to doing that, as we see today in Ontario.
Isn't that amazing? Here we are, Full Circle in Ontario on Change Day, seeing so many people who are also tapped into change, want to be mobilized and part of the movement to improvement. And you set that up, and it has really taken like wildfire. And I think that's a lot of what we're going to talk about today, how to mobilize people and teams and communities and groups. Cathy has been, steering the Change Foundation through a number of iterations around meaningful improvement and change in Ontario's health system. And we'd love to learn from your thoughts around leading this kind of change, what you've learned over time, and what's your best advice, sage wisdom around what matters most.
So I think I'll answer that by actually talking about the different changes of the Change Foundation. So we came to learn after a number of years of working on integrated models of care. We were doing really good research and lots of policy papers and networking with leaders and so on, but we came to learn that change actually needs to be in the delivery system itself, and that it needs to be led by the people who are providing care. So we redesigned the way in which we approached our mission and our mandate, and frankly, we got out of the way. Mm-hmm. So we designed opportunities for teams, communities, organizations to identify their own priorities through a co-design process. So we had to be led by the voices of patients and of caregivers. And then we supported them to do the work, but we never told them exactly what they had to do. So I know it sounds a bit strange to say you need change by getting out of the way, but I actually think that's kind of a fundamental principle.
And what have you learned from that journey? Which one mobilizes and unleashes the potential?
Well, people need to own the change. And so if you're coming in, from the outside and saying, we're going to do this and you're going to do it this way, that's not ownership. So when you've identified a goal, and in our case, it was we wanted to improve patient experience, we wanted to improve caregiver experience, that was all we said. And how that was done, and the teams that wanted to do it took it on as a passion and designed for themselves. And we support them in that process. That's the second piece of that's the second lesson. We can't just leave people to manage change without any supports. We won't learn how to do that in any of our professional, educational programs. And so we sort of took a step back and thought about what we can provide as a foundation. And it could be anybody, it could be an employer, it could be government, etc. We needed to provide training, we needed to provide supports, we needed to provide a safe space to talk about when things were not going well, and we needed to be directed by them when they identified help they needed. So get out of the way and support them.
I would say I think that's really good advice. I think it's very important that senior leaders get out of the way. You know, not just from organisations like ours that go and help people, but I think formal leaders, you know, need to as well. And I think, you know, very often the job of senior leaders is about setting the direction and making sense of things for people and you know and giving permission. And you know, and I just think so much of what we need to be doing, I think something that both our team share, you know, is just thinking like, how can we unleash the collective brilliance of our frontline staff and patients and families as well. You know, I see that time and time again in my work, that, you know, when we create that opportunity to work in different ways, you know, people never let us down.
Yeah. So I think it actually would be of interest to people who are joining us today for you to talk about your role, because what Helen does is a transformation team that's working within the system, and we don't have anything quite similar to that in terms of the scale of what you do. So maybe say a few words about that.
Yeah, so maybe, Cathy, I'll talk about, so it's always good to talk practically, isn't it?
Yes.
So I'll maybe talk about a project that my team works with. So one of the projects that we're working with at the moment is around frontline ambulance staff across England. And we have a lot of ambulance services. We have 10 ambulance services in England, and you know, we have a situation where I think, you know, as in Ontario and other parts of Canada, you know, we have very, very big issues and challenges around urgent and emergency care in winter, and people waiting inappropriately long times for ambulance response. So the Chief Executive of the National Health Service, NHS England, he went out with a number of ambulance crews. And you know, what he found was that the paramedics and ambulance technicians had really good ideas about improvement, but they were in a system that had kind of no place for those ideas to go. So my team, which is called the Horizons team, what we do, we work a lot with frontline staff around how we enable change to happen. So the Chief Executive of NHS England said, I want you to work for 12 months with frontline ambulance crews to help them to come up with ideas, and then to help change to be implemented across the country. So the first thing we did, we worked with 180 frontline staff for a day to with patients as well and family members to design a program. And we set something up which was an ideas platform where frontline ambulance staff could put their ideas across. And we got 31,000 interactions with that platform and 608 ideas. And you know, we work with a design team of frontline staff from across ambulance services to identify what are the things that we should be doing. We're doing prototyping and rapid testing, and you know, we have to do it virtually because in our system we have an issue which is called abstraction, which means if you want to engage frontline ambulance staff in quality improvement or in change, you can't just keep taking them away from their clinical duties. You can't abstract them. So everything we do is virtual. Actually, the technology that we're using today, which is Zoom, you know, very often we work with hundreds of people, you know, using this technology to enable change to happen. So we're well on our journey now, and as soon as I get back to England, next week I'm working with this group which is redesigning across the whole of the country how we support frontline clinicians, frontline paramedics, to respond to people with mental health crisis or emotional distress. And another day we're working across the country around how frontline staff can better respond to falls. But because we work in this very, very virtual way, it means that we don't just work with small teams. Actually, we can work with people across the whole country at the same time. And what we do is we connect people with one another. Because the real practical experiences of change that many of our colleagues have got just don't get spread. So to just even create a space, a virtual space where people who are focused on the same thing and focused on the same challenges can actually can talk to each other. And when we do that with some good improvement science, with some clear goals, I think we can get some great results.
So I think our equivalent, not the same scale, but the way of working would be our change and care teams, where we have 4 large teams that are comprised of healthcare professionals and staff and caregivers, different parts of the province, all trying to look at how to make the experience for caregivers better. And there was a lot of sort of idea generation at the beginning, and people said certain things couldn't be done, and here we are 2 years later with all kinds of exciting initiatives because they embraced it, they were supported to do it, and they designed it, and now they're implementing it. So it can. I mean, I think part of people's the pessimism that we saw a little bit earlier was it just can't be done, and it can.
One of the things we would like to do, and we're going to continue to learn from the experiences of Helen and Cathy. Also, I'd like to encourage you to please ask your questions in the chat room, because I'm going to ask a question of both Helen and Cathy, and then I'll turn to the chat so that the conversation is really directed by you, that you get what you need out of this and what's on your mind and most important. Some of what I'm seeing so far is that so much mobilizing is happening, but it's not happening all over the place. Not everybody understands that the role and the opportunities to get out of the way to help unleash the potential of their teams and their communities. Great feedback so far, and please keep it coming, and please send us your questions. Cathy, I'd like to ask you first and then turn to you, Helen. We have a new government in Ontario, and we are expecting system reform. We want to work together to improve Ontario's health system. What are your thoughts around our opportunity in Ontario and how we think about change and enabling improvement in Ontario's health system, knowing that we are going to have reform?
So I think we are at kind of an interesting juncture, because we've had 25, 30 years of diagnosis of the health system and what works and what doesn't work, and lots of good work and reports and commissions and so on. And the description hasn't changed that much. The issues are relatively similar. So Ontario doesn't have a big history of big scale change the way they do in the UK. We don't move the deck chairs around that much. We don't create lots of new acronyms and organizations. And it does feel like with this government that there is an appetite to do something a bit more bold and dramatic than perhaps we have seen in the past. What that is, obviously, we wait to see, and there'll probably be some disagreements about what the details are. But I have the sense that there will be an opportunity for communities to come together, for people to work together in different ways, that they will be able to come up with solutions that make sense for their local communities, and it won't be, it all has to be one size fits all. So if people have the opportunity to participate and reimagine and are supported in that, then some of the issues that we've been dealing with forever, lack of coordination, lack of integration, etc., may actually get solved.
Thank you, Cathy. And Helen, you've been through 9 restructuring.
Yeah.
And in your career as a health system improvement leader and change agent, that is every 18 months since you've worked at a national level. Can you tell us how you think about your role in a system that is constantly restructuring and reforming, and how you feel your role has helped mobilize change in a way that some of the formal systems haven't been able to?
Okay. So if I forget the second question,
yeah,
okay, don't let me.
I will remember.
Yeah. So what do I think? So yeah, I'm part of the system in the National Health Service in England that where restructuring is a thing that we do quite often. And yeah, sometimes I wish we didn't, because again, it's when you think about politicians and 4 or 5 year electoral cycles, and having ambitions to do things in better ways and to make better use of money and get better outcomes for patients. Actually, restructuring things is kind of one of the key tools that the politicians have and senior leaders have. Personally, I think there's a lot of evidence that says actually so much of this is about relationships, not structures, and restructuring doesn't always change relationships, and it doesn't necessarily make things better. Having said that, doing the job I do, I get amazing opportunities to engage in change. Working at a national level in the NHS, and I would never get those kind of opportunities if I worked outside or I worked at a different level in the system, because the kind of work that I do and my team does, when we get it right, it can make a really big difference. So, being in a system that restructures itself is kind of part of the price you pay for getting the opportunity to do the kind of work that I do, and it's kind of like it's the deal. So, having said that, I think that restructuring can be very distressing. It's exhausting. It means that you're constantly being consulted. It leads to uncertainty. You get a new boss. So if you said to me, honestly, would I prefer to spend a lot more time supporting people to make change happen rather than being restructured? And yes, of course, I would say that. But it's a kind of it's an inevitable part of the system, and I think you just have to have the right attitude to it. It's not personal. It's kind of part of the big picture. And I also think there's real differences in the way that teams go about this. So we're currently being restructured again, and my team is going to be moved into a different team. And it's kind of how it is. However, I would say that the restructuring that we're having at the moment, I think it's being managed well. In the sense that we're being consulted. There's lots of communication. There's a big understanding of why we're doing it, not just what we're doing. And I think we have to accept it with a good heart and understand that it's part of the bigger picture and a good intention, and just go with it. And my job as the leader of the team is to help people through that. Is to try to reduce ambiguity for people, and make the change meaningful, and make it as easy as possible.
So Helen, I'm going to get you to talk for a minute about what you did on Tuesday here with the Ontario Hospital Association, where we had teams coming in, essentially to talk about change management, and maybe just walk us through what you did that day.
Yeah. So yes, on Tuesday. We had a little over 100 people, most of whom were in teams, came to the Ontario Hospital Association for a workshop day. And the theme of the day was, change into the future. So how can we, as teams now, be ready for the future? So we did lots of really interesting things on that day. Oh my goodness. Jodeme might want to say something about Tuesday as well. So we looked at a lot of different themes around how the world is changing and how change is changing. So, for instance, I think anybody that works in change and improvement, we have to talk about power, because I would define power as like our ability to get the outcomes that we want. And very often, when you're a change agent or a leader, in the middle of a system somewhere, you think, I've got no power to make change happen. And yet, all of us have got a lot of power. I would say we just don't realise it. We don't use it. So we talked a lot about power, and we looked at people that are informal influencers. So what you typically see in an organisational system is that there's about 3% of people in the organisation who drive conversations with 85% of the other people. And if you want to make change happen across the whole system, then you find your influencers or informal influencers and you work with them, because they're the people that can be very influential in terms of getting other people to engage with change.
And Helen, some of the questions that are coming in right now really relate to that. So Helen's talking about the 3% of people who have 85% of the potential to influence change. And some of the questions that are coming in is, what do we do when change happens to us and we don't have the opportunity to participate in creating the change? There's a number of questions around when people in formal positions make change and don't engage frontline staff, or maybe don't know how to co-create, or there's some questions around engaging with patients and family members. And so building on your idea of 3% of people in organizations and teams and systems have the largest opportunity to influence. Can you answer some of these questions and think about those influencers?
So what I would say, Jodeme, is that sometimes when you're in a situation, there's change that you can influence, and there's change that you can't control. So when change is happening around you that you can't control, you just have to go with it. So big restructuring is happening in my team at the moment. It's part of a much kind of grander, radical plan for the NHS, and I have absolutely no influence and no control over a lot of things that are happening. And in a sense, in that context, my job is understanding that's the case. I've got no control and very little influence. My job is to help make the inevitable thing happen in a way that we get good outcomes and my team are okay. But most change isn't like that. Most change, we've got far more influence than we think. But and it isn't just about other people doing change to us. It's the fact that we've got so much influence and power to make change happen, and we just don't take it. We just passively kind of accept that other people in the formal system, have got the power, and we have to accept things. So understand when it really is a change you can't control versus a change that that you can influence. And most of when I look back at I've been involved in some very, very big change programs. The first big national improvement program for cancer services, the first big national change program around cardiovascular disease, NHS Change Day, our School for Change Agents, what we did with those is you find the space and you make change happen. So and it's what's your mindset? Is your mindset I'm in a system and I'm powerless and things keep happening to me that I can't control? Or is your mindset, there's some stuff going on in the system that I can't really do much about, but that's how it is. However, I'm going to take the power I've got to make some changes happen. Mm-hmm. And I just think what we do is we take the power quite a lot.
It's evidenced in Change Day, thinking about how that movement starts and how we all have the ability within us to create the change. And it's starting getting me to think about and paying attention to what's coming in on the chat. This is for you, Cathy, to start and then turn to Helen. There's this tension between organization and system, between self and teams and organization, and then pivoting towards a collective working across organizations. Sometimes we refer to it as the tension between the ecosystem and the ecosystem, moving from honoring ecosystems within teams and organizations, and being able to move more broadly to partner and collaborate with the ecosystem. And Cathy, in the Change Foundation's role in enabling collective impact, you worked within organizations, within formal roles, people who hold senior roles, and frontline staff, managers, directors, patients and families and clients. What have you learned about managing that tension, and thoughts for everybody online?
So we start from a fundamental principle of co-design. That is, if that's not there, then the tension's there. And once you're in that mode, then there's an equalizing effect, because all of a sudden everybody is a partner.
And can you tell us what co-design is?
So it's it's creating processes to listen to the users of a system, the staff within a system, and the leadership in the system together. So we don't have separate conversations. And there's a learning that goes on. It's one of the things I love about the work that we do, because in every case, at some point in time, there's an aha moment. And that's when you've broken through the tension and people all of a sudden are on the same, the same team, because they've understood that together, what can be done is much more powerful. The piece that we, I think, have really focused on in the last 7 years is bringing that user voice, whether it's a patient or a caregiver, right into the decision-making process. And it totally changes the nature of the conversation. It changes the subject matter. It changes the priorities. And so you've got to create space for those relationships to be created before you jump into improvement and implementation, because they've got to learn about each other. They have to trust one another, because it's almost like they're going off a cliff together. Because when you start, our calls for proposals, we don't want people to tell us what their 10 great ideas are. We want them to describe the process they're going to go through to get those 10 great ideas. So it's a very different way of thinking, but if people go through that together, the tension does disappear.
Take a step, walk a step or two in each other's footsteps and go through the journey together. Helen has been thinking about both formal and informal power, and you refer to as structure and agency. And you've also talked about the tensions in with the mindset of working from within an organization and then working across a health system. Can you share with us your thoughts?
Yes, so really interesting things are happening in our system in England. So in 2 weeks' time, we're going to have our new long-term plan, which is it's the first time that we've ever had a 10-year plan for delivery and change in our system. And what we're expecting is that our whole country and our entire health and care system will move to what we call an integrated care system. So, the way that we've traditionally been organised, where we have a primary care sector and a hospital sector and mental health organisations and ambulance services, in given places, in localities, all those services will come together in an integrated way. So, you won't, you'll see hospital systems and hospital staff working in teams with primary care. Your identity as a team, not just being like, I work for this hospital or in this home care setting. No, we're talking about fully integrated systems. And I think that what is being planned is the most widespread integrated care system in any publicly funded health system in the Western world. And when you think about that, the kind of leaders that we need to be when we're like a leader of a hospital system or the leader of a community health organisation, it's about being like the independent, autonomous leader of an organisation. So, you're the person that kind of leads from the front that has to deliver the goals of your organisation. So you focus on the interest of your organisation and delivering goals of your organisation. That's what your board wants you to do. And when we think about integrated care, we're talking about a different kind of leadership. Because in an integrated care system, you can't have winners and losers. You can't say, well, primary care is going to get more money and hospitals are going to get less. We've won, they've lost. And in an integrated care system, it's got to be about people coming together and having the kind of leadership relationships that we would call interdependent, which means there's still we're still in situations where I still want to deliver all the roles in my hospital system, and I have to work collectively with other leaders around the system to deliver our integrated care system goals. So it's about partnership, it's about collaboration, it's about win-win, it's about much more complex system issues. And so one of our big issues as a system is how do we help leaders to move from being independent leaders of individual organisations to being interdependent system leaders.
So I noticed there's a couple questions on the chat there about governance, because in Ontario we still have a governance or a model where hospitals have their own independent boards of trustees, as do many other service providers. Can you talk a little bit about how the NHS governance plays a role in change management?
Yeah. So I'd say, governance is critical, and all the studies show this. I mean, even a couple of weeks ago, there was a new paper that was published by King's College London, which went into a whole series of hospital systems in England, and looked at the ability to deliver, board-level quality programs, and actually the nature of the board, the caliber of the board, the support of the board was one of the key things that matters when it comes to delivery. And we have to create governance mechanisms when people come together and integrated care systems, and there's lots of different ways of doing this. There's in some of it, it's about setting up separate organisations that leaders come together in. In others, it's about working through the current system in different ways. And what I'd say is there is an inherent tension here between having like a really effective board, an organisational level, and effective governance mechanisms at a systems level. And we need both.
There's a question. I want to build on the conversation around integrated care, and when you go to interdependence of leaders and frontline staff and others, and there's a question about vulnerability. And an article recently, one of our participants read that leadership change in this way creates vulnerability, and that's one of the biggest reasons it's difficult to create the interdependence or the integration or to work together collectively. Can you share what you've learned about vulnerability and the change process for people in formal roles to enable people to work together in a very different way?
I mean, for me, it has to do what you think leadership is about. And for me, it's not being, front and center stage. It's actually about enabling people to do good work together. So if the goals are clear, to me, it doesn't matter who the leader is as much as the process. Helen talks a lot about leadership in different unusual places, people who can really with passion lead change, and they don't have any formal. The woman that you talked about the other day, who's a ward nurse, I think, who was seen as a real leader in her organization because she was the go-to person. She was the person that knew what was going on and who cared about her colleagues. So I think for me, let's define leadership differently. And then I don't think the word vulnerable is such an issue.
Thank you, Cathy.
I would say that, as leaders, we have to lead with values, and we have to show that. So again, a lot of the work that my team does is around narrative and storytelling, and having situations where we as leaders can tell our own stories. Because, if we want to mobilise people for change, then, I would say the most effective way of doing that is by telling stories. Because, when we tell a story, we show our own values. Okay? And people will, even if we're very different people from different organisations, or whether I'm part of the formal system coming together to live with the informal system, and you might say we've got nothing in common. But when we start to tell our stories, and we and talk about things that happen to us that are difficult things, and we show our values, then I think that is the most effective and powerful way to connect people with change, because then people start to recognise that the change that we want to do isn't about cutting costs or taking things away or creating loss for people. Actually, when we talk about why the things we're doing are important to us through our own stories, and we show our own values, and then people will engage. So when I went to I took part in the most amazing workshop a couple of weeks ago, and it was a workshop for working a lot on ambulance system for people from Black, Asian, minority and ethnic backgrounds who work in ambulance services, and very often people with those with BAME backgrounds have a really hard time. So 3 times as likely to get disciplined, don't get promoted in the same kind of way. So that's this network that's been created of people from Black, Asian and minority ethnic backgrounds, coming together, and it was their national workshop, and the title of it was getting white people to talk about race. And sometimes the thing is that as white people we don't want to talk about race because we're frightened we're going to say the wrong thing. And 2 of the chief execs from the ambulance service stood up there on the platform, and they talked about what was going wrong in their organisations from the point of view of the experiences of their Black, Asian, minority ethnic staff. And just the fact they stood up there and said the things they said and modelled the vulnerability that they did, I mean, it was so powerful for that audience, because they were just showing their values through their vulnerability, and I just think we connect as humans, and creating a safe space where people could do that, was a really incredible thing.
There's I want to build on that, because there was a question online around how, and this does come to vulnerability, when decisions are made in places and spaces that don't connect with people doing the work. Some of the people doing the work at the front line are asking, what is your advice to those around how to meaningfully engage with those that are working on the front line to co-design solutions to the problems that we want to address? And there's a couple frontline workers that said frontline. What's your best advice around how to do this?
So, yeah. So my number 1 piece of advice is if you want to be a change agent and you want to make change happen, you can't do it on your own. So I think you have to find other people that are passionate about the same things that you are passionate about. And you might find them in your own organisation, you might find them on social media. Again, just tell a little story. We just have the most amazing social movement that has swept our country, and it's called hashtag End PJ Paralysis. And basically, we had this most situation that we had in our country was that tens of thousands of people, typically over the age of 80, were lying in hospital beds wearing night clothes, and the impact that this had on muscle wastage and their ability to go back and live independently rather than having to go into the care sector was really profound. And it was, a few frontline nurses kind of picked this up and started it. And then it just spread across the whole country. Hashtag end PJ paralysis, and it's worth looking it up on social media because it's pretty amazing.
I added it to the chat.
Yeah, right. And so what then started to happen, it was creating such a kind of movement and momentum that formal leaders took it up. So, chief nurses were really encouraging and supporting frontline workers in their hospitals. And in the end, we had a nationwide 70-day challenge. If you look at the data from that, it shows that across England, in those 70 days, that 712,000 days worth of precious time of people's time that would otherwise have been spent in a hospital bed or in a care home were saved. And it's all about people at the frontline care, connecting up with other people that are passionate about things and getting on and making things happen. And when we work in that way, we think we have to ask permission, but sometimes when we kind of get on with it and do it, actually our leaders really like it. So I'd say, don't do this on your own. Find the things that you feel really angry or passionate about, and find some other people that think the same way and want to do something.
And I would just probably add to that I think for the work that we do, one of the most powerful tools that we have is a patient or a caregiver voice.
Yeah.
Because when somebody stands up in front of a room of healthcare professionals who are there for very good reasons and tells a story about how difficult their journey was, people respond to that because nobody wants it to be that way. So a lot of the starting of the work that we do, we have patients and caregivers lead the conversation because people put themselves in those shoes and think, I don't want that to happen to my family, or I don't want that to happen to another patient. And then there's already a place to start because there's an agreement that something has to change.
Looking at the time with a couple minutes left, I'd like to turn to both of you on all of our behalf, on the 200 folks online and others in Ontario that we want to share this information with after. As we're going through health system reform in Ontario, and we want to create agency in every single one of us to mobilize meaningful change, what is your best advice to everybody online and those of us in Ontario who are empowered to really make a difference?
So my advice, Jodeme, would be find the opportunity in what's going on. Because when even if the change is of a deeply structural nature, what happens in organisations and systems is that when you start to things are in a transition, it feels like a really bad time because things are really confusing and we don't know what's going to happen. But you know what? They're the best time for doing innovation and change. That phase when you're no longer what you were. But you're not yet what you're going to be. And I'd say grab the opportunity in that very special in-between time and use it to make some good things happen. Because actually, history shows us, evidence shows us that in-between time is the very, very best time for innovating. Even though it feels like the worst time, it's actually the best time.
Thank you, Helen. And Cathy?
I guess for me, it would be don't try to standardize everything and make it all look the same. Allow people some space and some freedom to design what makes sense for their local circumstances. And that probably is more of a plea to government than it is to anybody else. But I think the opportunities will be greatly enhanced if it's not one size fits all.
Thank you both. And the final comment is, people can't say it better than that. I'd like to turn to everybody online and, thank you for being so interactive with us today, for participating, for sharing your questions to help inform today. It was a short conversation, our first of many out to Ontario as a way for us to be inspired, to mobilize change within each of us, within our teams, within our organizations, and across our health systems. And, you know, the words between the two of you, it's the in-between time, just before we have reform, which is the best time to innovate and allow us the freedom to mobilize change. And a special and warm thank you to Cathy, who has led the Change Foundation in Ontario through so many iterations to enable collective impact, and to Helen, Bevan, the Chief Transformation Officer and really the guru of change agency in the UK and around the world, who also enables collective impact through her Horizons team. A warm thank you to both of you, and an honor for me to facilitate this conversation with both of you and everyone online. Thank you for all the comments, thanking us for this opportunity today. And we want to thank you for joining us, and I hope you'll join us in the near future when we do the same. Wishing you all a great rest of the day. Bye, everybody.